This is Dr. Daniel again, coming to you from beautiful Prescott, Arizona, founder of Quantum Techniques. I just wanted to share another tip that might put you on the right track. This is something I learned many years ago, long before I was doing Quantum Techniques. And, I was a clinical psychologist. I visited some people in their homes when they were unable to come and see me, and they'd come to my office. And I noticed a pattern where a lot of elderly patients were fine, they were sharp. And 3 days later, their family would call and cancel the session because they lost it. They were hallucinating, they couldn't think. It's like they got dementia overnight. Dementia doesn't work that way. So what we know is there's two main causes. Both often are overlooked by physicians. Number one is a B12 deficiency. A lot of times when you age, you eat more processed food. You're not getting enough B12 in your diet. Or you're getting enough B12 in your diet, but your gut's pretty compromised from all the issues you really need to heal, like with Quantum Techniques, and you haven't. So usually if that's the issue, B12 oral is limitedly successful, like tablets or lozenges. B12 injections, which bypass any compromised gut, will perk a person right up, in 2 or 3 days, and they'll be out of that middle state. So that's number one. Number two is really hard for traditional medicine to diagnose. This just happened this week. Working with a very sharp 97-year-old, and their family called and said, wow, she's in a sense gotten paranoid, asking all these questions, seeing things that aren't really there, confused. The in-home nurse thought that maybe they've had a stroke. Before I scanned, I said, no, I don't, I've been working with this person like once a week. I said, that's not what's going on here. And what it was for her, which is the second major cause, is an undiagnosed viral urinary tract infection. It can also be bacterial, but traditional medicine can take a urine sample and they'll find a bacteria there. Now, maybe not a hidden bacteria, but viruses, they don't find that way. And that's something we can clear. They can take a nice, safe antiviral, which I'll mention in another YouTube about good natural antipathogens that are safe for most people. And they'll be fine again in 3 weeks. No need for MRIs and brain scans and everything else to evaluate their neurological state. Let's just do what's easy first. If you don't know how to test, give them a B12 injection and give them antivirals. Because the antivirals that I recommend are also antibacterial agents, and most of them are also antifungal agents. So whatever pathogen is in the UTI field, it'll clear it. So I've just seen so many people hospitalized or expensive neurological workups when the answer could have been found in 5 minutes with Quantum Techniques and corrected, maybe 15-minute session. So again, the only thing that heals is the truth. So if the truth is you're not demented, they're not going to find that no matter how many tests and how expensive. If the truth is you're B12 deficient, and you don't have that, you're going to stay sick. If the truth is you have a viral UTI, and sometimes they don't clear for months or years if they're not shown to the body. You don't need to be in an inpatient setting to discover this. You can do it from a phone. All of our work's remote. We have somebody on call part of the day, 7 days a week. So you can call somebody and find out what's causing your symptoms with Quantum Techniques. And then again, if you buy the Truth Techniques, where we teach how to do this, it's about 2.5 hour long DVD. It's very instructive. You'll be able to do this on your own. So again, just a healing tip to help you and especially the elderly in your home with Quantum Techniques. Have a great day.